Hi everyone, we're going to be talking about skin rashes tonight. The symptoms, the causes, and natural support strategies. And this comes from a Dr. Jocker's article on skin rashes. Today you may have lots of questions, and Dr. Udani is making herself available. Her number is 437-702-2112. Just feel free to give her a text. I wanted to welcome Dr. Udani with us today. She's our naturopathic doctor here at Justine Blaney Wellness Center. She has really in-depth knowledge in women's health, stress, chronic pain, digestive issues, and skin conditions. She's very passionate about what she does, and she genuinely believes that everyone has the ability to make healthy, long-lasting changes. Please help me welcome Dr. Udani.
Thank you, Angela. Good evening, everybody. How is everyone doing? So tonight we are talking about skin rashes. I want to just talk a little bit about what we have coming in the future. So we are going to be talking with Dr. Justine about what is whiplash. There's going to be talk on that. There's also going to be talk on what are some of the daily decisions that we're doing that could be draining our energy. There's also a dine with doc that's happening as well. And we are also going to talk more about ready to live your life with less stress, because stress is everywhere. We're all dealing with it, but what are some of the things that can help us deal with stress better? And a detox workshop, which I will be doing with Dr. Justine, about all the toxins and hidden health threats around us and how we can minimize all of that. So these are amazing webinars that are coming up, and I hope you join us for these. So tonight we are going to talk about skin rashes, the symptoms, the causes, and natural support strategies. This is based on one of the articles by Dr. Jockers. And, I personally have an interest in skin. So this is something that is near and dear to my heart, especially because I used to have acne for a long time, for over 10 years. And I was able to holistically heal acne on myself. And I really promote this with my patients as well. So this is a topic that I love to talk. So many things. There's so many interesting things that are, coming up to the surface about how we can heal skin naturally. So if you do have questions, I'm always here available to answer any of that. So let's dive right in. So with skin rashes, we're always thinking about how can we stop moisture loss? Because, if you think about our skin, it's like it is just the best barrier that we have against losing too much water. Because, we are more than 60-70% composed of water. So our skin is the biggest barrier against moisture loss, which is very important to maintain our healthy daily functions. So normal skin is it's composed of tightly packed brick and mortar type cells. So they have the packed cells, and in between we have fatty acids that kind of hold the cells together. And this creates a very nice, formidable wall. But what can happen with skin rashes or, anytime the skin is stressed and there's inflammatory reaction is that you can develop skin rashes, you can develop dry skin, you can develop things like eczema, acne, for example, that is a sign of a damaged skin barrier. So today we're going to talk about some of these concerns and conditions and how we can naturally help heal the skin barrier. So these are some symptoms of skin inflammation. So, if you've had a rash, your skin can look red, it can look a little bit itchy and things like that. So these are some of the signs of skin inflammation. So acne, pimples, like I mentioned, I myself used to have acne. So this is definitely is a sign of skin inflammation. Blisters, sign of inflammation that can happen immediately, when it is exposed to something that is triggering. And eczema, of course. Too many wrinkles, so premature aging can be a sign of skin inflammation. Age spots, another sign. Rashes, as we were mentioning, cracked or raw skin, itching or burning skin, redness or skin warmth, too much redness or too much warmth in the skin, and even thickening or scaliness of the skin can be signs of skin inflammation. And skin is a mirror of what's going on the inside. So whenever we have too many of these signs, we got to take a deeper look at and figure out what is really going on the inside. So these are some of the skin types of skin rashes. So, there is a huge range of what is considered a rash, So there's things like eczema where, you can have it, it can come up, um, because of a trigger, or you can have it continuously. There's viral rashes, which happens when you're exposed to a certain virus, and especially children, when they have a viral infection, they can develop some rash from that. There's also, of course, skin rashes you can get from poison ivy or poison oak. So when you touch it, there's an immune reaction. There's drug or food reaction too. So this can be after you eat something that is supposed to is allergic inducing, you can have a reaction, like a rash or hives and things like that. Heat rash, of course, if you've been exposed to too much heat. Then there's also something called intertrigo, which is when there's a rash induced by too much friction, and too much rubbing can cause a skin rash too. And bug bites is another type of a skin rash. So there's a huge range. So if you are experiencing any of these, you want to first figure out, is this an emergency condition and you need to go to the emergency room to really get medication, or can we heal this in a more holistic, natural way to prevent it from happening long term? So these are some of the signs and symptoms of rashes. So of course, there's going to be redness, and not everyone might experience redness, especially if if you have, darker skin tone. It might not be very evident. But of course, then there's also signs of swollen skin around the rash. There could be scaling of the skin, blotchy skin color, itchiness, burning sensation, sometimes tingling sensation can come from a rash too. Of course, dry or crusty skin after you scratched it so much, they can be really, really dry and crusty. Blisters or oozing, so there could be some clear liquid coming, oozing, or pus oozing. And pain can be another sign of a skin rash. So here is some factors that can trigger dermatitis and eczema. So skin rash, like the scientific medical term for skin rash, is one of them is dermatitis, which is the irritation of your dermis. And eczema is a type of dermatitis. It's called atopic dermatitis, which is the scientific name for eczema. Let's say it like that. So things that can trigger this is, for example, chemical irritants. Soaps, lotions, shampoos, anything with a harsh chemical. Some patients that I've talked to also develop it from just being exposed to fragrances. They could be as sensitive as that. Environmental allergens, of course, too, dust mites, pets, pollen. When the weather changes, you might experience a rash or hives popping up. Very hot or very cold temperatures can, trigger a change in your skin color, skin tone. And itchiness and rash can come up too. Mental and emotional stress is another huge trigger for eczema. When we're exposed to stress, our inflammation kind of goes up, so that will trigger a host of other different things, including eczema and skin rashes. Food sensitivities is a big one that I personally see in patients, and I help to heal the gut to help reduce sensitivities to food that can help with eczema and dermatitis. Hormone changes is another big one. So, sometimes with their periods, or even if you're entering perimenopause, we can notice skin changes, and sometimes the skin can be more sensitive to rashes, pimples, acne, all of those things. And microbial overgrowth. So this can be anything from fungal overgrowth to bacterial overgrowth, because our skin, on top of it, there on the skin, we have a lot of bacteria, a lot of different kinds of bugs living. And when there's overgrowth of the bad ones, we tend to sometimes experience skin rashes. So these are we're going to go a little bit deeper into the causes and risk factors. So, contact dermatitis is very, very common if you basically, let's say, for example, even if you wear some certain metals like nickel, and it can sometimes cause a irritation around that area. So that is what's considered contact dermatitis. So for example, when I was younger, I used to have a reaction against like nickel, or really when I would wear earrings, I would get a rash in my ears. So that is considered contact dermatitis because you had contact with it. Of course, this also can be applied to any kind of lotions, fragrances, soaps that can cause irritation of the skin. Bug bites, fleas, tick bites, scabies, which is like tiny mites, can also result in rashes, and that can be a sign of, infestation, of course, right? At your place of living, or it could be after you traveled somewhere and came back or went hiking and you notice the skin is irritated, and that could be a sign of something a little bit more serious, like Lyme disease, for example. So even like a tick bite can present as a rash. So this is something where you want to be a little bit be mindful and watchful, especially after if you've gone out and gone hiking and things like that, to really take a deeper look into your skin. That way you can prevent potential development of things like Lyme disease down the road if you took care of this rash. Fungal infections, of course, things like ringworm, candida can cause rashes. Sometimes it can even cause skin discoloration. Fungal infections are actually on the rise because of how much our diet is, how much sugar that we do consume in our diet. Fungus, like, they love sugar. So that's a tip for you, is to really control that sweet tooth if you are experiencing like recurrent yeast infections, fungal infections. And bacterial infections, things like impetigo or cellulitis can lead to rashes. And of course, viral infections like chickenpox, measles, hand, foot, mouth disease, another reason. Rosacea usually is a rash that affects the face, and it can be really, really uncomfortable and painful at times too. Eczema is, of course, a very common skin problem for many people from different ages, from babies to children to adults. And it is also more common if you had a history of asthma as well. Medications, of course, can cause allergic skin reaction and make you more sensitive to sunlight, which makes you can you break you out into hives and things like that. Diaper rash, of course, and autoimmune concerns like psoriasis, and even eczema is more of an autoimmune condition as well. So we want to take a look at that as well. So what is the difference between hives versus rashes? Because it's kind of can be a little bit confusing to figure out, like, how do I know if this is something that I need to really take a look at, or is it something that is I can just like wait a little bit longer and it'll go away on its own. Usually, the definition of a hives is, it's a rash, it's round red spots on the skin that can be very, very itchy. And sometimes they can be dangerous and swelling and be a result of an allergic reaction. So, if, let's say, for example, you have a nut allergy, you might notice you can break out into hives immediately. And so that is a sign of, okay, this is a little bit more of a red flag. It's an emergency condition. We want to go and get this checked and, get it treated immediately. Whereas a rash can sometimes come on over a long period of time. And it doesn't necessarily have to be itchy. It doesn't necessarily have to be swelling either. And sometimes the nature of the hives could be very specific, like allergic reaction or a sensitivity to medications, or you touch poison ivy, poison oak, things like that. And rash is just more of a general term that kind of it's like an umbrella term for all of these like skin problems and issues you could experience. And hives can sometimes stay in the body for a few days and then can disappear without any issues. Rashes can stay for a long, 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 long time, and like could be even months. And hives is usually caused by an allergic reaction or an infectious reason. Rashes can sometimes be, yes, of course, be an infectious, but could also be an underlying issue, like an underlying disease or things like that. So this is where it's really important to figure out what it is, where it's coming from, and see if there's an underlying issue that you just need to get checked out. And of course, hives, the appearance is it's usually round and it's shapeless symbols in the body that may or may not be painful. And rash tends to look a little circular, and can be, can feel a little painful as well. So this is a little bit of a difference between the hives versus rashes. For me personally, I always think of hives as you have more of the swelling, it can be itchy, and rashes can not necessarily be itchy at most times. So here are some conventional treatment options for rashes. So, of course, let's say you go to a family doctor, a dermatologist, they might prescribe, a corticosteroid, which is a steroid cream to kind of calm down the inflammation. So it's an anti-inflammatory and it helps to calm down inflammation, and it will work really well for the time being. But a lot of the patients that I do see, they end up saying that it worked for a bit, but then it kind of kept coming back and again and wasn't really able to fix it, and then started to use stronger and stronger steroid creams. But there's of course side effects with depending on a steroid cream for that long. Of course, you can also change your personal hygiene and skincare to make it more natural, to cut down things, because sometimes we're using too many products can irritate your skin too. And you can also be prescribed things like antihistamine medications. And this, like a lot of antihistamine medications, are anti-allergy medications because they help with reducing the histamine in the body. And think of histamine like this little molecule that just ramps up your immune system and causes hives, causes allergic reactions and like just all over the body. There could be a lot of different things happening. Of course, there could be calamine that you get for poison ivy, poison oak to calm the skin, and over-the-counter aspirin, Tylenol, things for reducing the pain. And sometimes you might even be prescribed a antibiotic or antifungal if it ends up being a bacterial or fungal infection. So, but what do we want to know? We need to figure out what is really causing this skin rash, especially if you know, okay, it wasn't poison ivy, it wasn't poison oak, it wasn't a bug bite, it just came out of nowhere. I'm not sure what's really going on here. So we got to get to the root cause of this rash. And so this is where I like to dive deep into your personal history, your eating habits, your stresses, anything from your sleep habits, all of that, your digestion, of course, too, to figure out what's really causing this rash. Because, like I said before, your skin is a mirror of what's going on the inside. So we really got to see what is the root cause of these rashes. So a lot of times there is gut dysbiosis or underlying low-grade infections that is ramping up inflammation, and that your skin is showing signs of that. There's food sensitivities. There is too much histamine. Like I said, that little molecule that ramps up the immune system. There could be too much of it in your body for whatever reason. So we want to figure out what's going on there. Sometimes it's deficiency in nutrients like vitamin D. So we will do testing, lab testing, to figure out what's going on there. And of course, seeing if there's any environmental allergies or something that's irritating your skin that you're exposed to, but you're not even sure but it could be. And of course, sometimes it could be as simple as skin friction. So how to figure this out is, a naturopathic doctor's job. And that's where we want to figure out the root cause of what's really going on with your skin. So let's talk about root cause number one. Of course, it is one of my favorite things, and it is gut dysbiosis and infections. So what is dysbiosis? I know it sounds like a really hard, long, complex word, but what it really means is it's an imbalance, okay? So there's an imbalance between the good bacteria and the bad bacteria in your gut. So just so you know, our gut really has, for the most part, a lot of good bacteria. These are the good guys, and they keep the bad guys in check. And these bad guys are they're a little tricky too. They're not necessarily bad all the time, but when they're in check, they're okay. But it's only when the good bacteria starts to get damaged for some reason, through diet, through stress, through poor eating habits, and that when the good guys start to go down, these bad bacteria kind of become a little bit more naughty. So they tend to be like, okay, we don't have any more of the good guys kind of keeping us in our place. So let's just start producing more inflammation. Let's become bad bacteria. So we call them opportunistic pathogens because they take that opportunity to become and take advantage of the situation, and they become more inflammatory. So that is what can cause gut imbalance. When we don't have as many of the good probiotics, good gut bacteria to stop these bad guys from spreading out and creating crazy inflammation in the gut. So, and root cause number two is food sensitivity. So, what is the difference between a food sensitivity and a food allergy? So, allergies tend to develop from when you're little. So, think about things like peanut allergy, shellfish allergy, any kind of tree nuts, any kind of allergies like that. You tend to develop as a child, and the reaction can be immediate. When you eat it, you get the hives, you feel the swelling, you feel the rashes, sometimes difficulty breathing, things like anaphylactic shock. That is considered an allergy, and this is more fun if you experience this as an emergency condition. So you want to make sure that it is assessed and treated right away. With food sensitivities, these can develop actually at any age and usually comes up with some symptoms of bloating, could be joint pain, IBS, you feel tired, you can't focus, sleep is off, you have cravings, headaches, and weight gain. So it's not deadly, but it's just not giving you that quality of life that you deserve. So sometimes these sensitivities can be delayed. So let's say you have a gluten sensitivity. So you have bread, and then for the next 6 hours or 8 hours, you just feel bloated, you feel lethargic. It's just not sitting well with you. So that I would consider it as a food sensitivity. So it's a little bit more long term. The effects can last for longer compared to an allergic reaction. And there could be a lot of food sensitivities that you might be experiencing. And that to me is a sign of a leaky gut. So if you're eating just anything and you're getting that bloating feeling, that could be actually because of leaky gut caused by root cause number one, which is the gut imbalance. So let's go to root cause number three, which is histamine intolerance. What does that mean? So your body is just not able to tolerate histamine as good as it used to. So like I said, histamine is that little molecule that ramps up your immune system because think of it as a green light that tells your immune system to like go crazy and cause lots of inflammation. So what can happen is you can have too much histamine absorbed from food because there are certain foods that do increase histamine, especially things like processed foods, can be very high in histamine. And then so you can have a lot of that, and then your body can absorb a lot of that histamine. And you can also have a lack of the enzyme that breaks down histamine, which is the DAO. So if you have little of that, you have all of the histamine that's not broken down, that just gets absorbed and can cause a lot of issues, like things like hives, things like stuffy nose, sinus issues, and sometimes even like difficulty breathing. Things can be this can be a result of histamine intolerance. And of course, deficiency in vitamins, especially vitamin D deficiency, can be a cause, one of the root causes for skin rashes, especially eczema. So, vitamin D, of course, is amazing and it is so necessary in so many different things in our bodies, not just for bones, not just for absorbing bones or for immune system. It's really good for skin, it's good for your hair, and it is just it's something that we really want to test before we guess about how much you do need to take. And this is something that I do, of course. I do vitamin D testing because we want to see if you are deficient, and figure out what is the best dose for you to go from there. And yes, another root cause is environmental allergies or irritation. So, if you notice that your skin rashes tend to ramp up during springtime, summertime, or even fall, winter, there could be some kind of irritant that's in the air that's causing these reactions. And a lot of times there is hidden mold. So, especially if you live in older homes, if you have a lot of carpeting, a lot of moisture trapped in your home, you might experience rashes throughout the whole year. And that could be because of mold indoors. And mold not only can cause skin rashes, but it can also cause a lot of sinus issues, fatigue, uh, difficulty focusing, just sleepiness. A lot of that inflammation can be from mold as well. And pet dander, of course, is another one. If you have a lot of that inflammation, so let's say you have gut imbalances, you have food sensitivities, you have histamine issues, and you add this, your bucket of symptoms or illnesses is almost at the top. So then you're going to be feeling a little bit more, you're going to be getting more symptoms. So let's talk. So now that we talked about some of the root causes, let's talk about some natural support strategies, because we always want to give you as much information as possible. We want to explain things to you, but also give you concrete steps that you could start doing within these talks. And of course, I want to say, if you want more individualized protocol, it's really, really a good idea to talk to a healthcare professional first, because we want to make sure that whatever you're trying is doing its best, and it's not affecting any other aspects of your life. Because a lot of us are taking different medications where might have different lifestyle factors that affect how these strategies would be useful for us, or how good they will be helping us for. Okay, so let's talk about first one is anti-inflammatory nutrition plan. So of course, this is a cornerstone. When you're trying to lower inflammation, we want to make sure that diet is good. Diet is the best, like a big foundation. Diet and exercise, of course. And we want to increase fiber and increase water in your diet. Add lots of leafy greens, lots of because they contain a lot of good anti-inflammatory components that can help with a lot of liver support as well. And this just helps to make sure that you are your diet is clean, or as clean as it could be. And these are some of the tips that you could do, which is of course you can add in more leafy greens. You can consume foods rich in silica, which is like cucumber, celery, carrots, because silica is important for hair, skin, and nails. It helps as a building blocks. Adding in sauerkraut, so fermented food, sauerkrauts, pickles, kimchi, apple cider vinegar, because they help with your good bacteria in your gut. Eating healthy fats is very important, because a lot of our skin, like I mentioned, it has the skin cells, but in between, what's keeping it together is the fatty acids. So eating healthy fats like avocados, olive oils, coconut oil, nuts and seeds can be very helpful too. And things to avoid, of course, having less processed foods as possible, cutting down the high carbs, high sugary foods. Vegetable oils can be very inflammatory, so we want to cut down the fried foods, commercial animal products, and sugary drinks, and just diet drinks. All those are things to avoid. And we want to add in more of the good stuff. So of course, when you're starting a dietary change, it is so good to get help, figure out where to begin, what things to do. That way you don't feel overwhelmed. Sometimes doing these changes can make you feel overwhelmed and stressed about where to begin. It's because it can be very confusing, and so much information out there, right? So this is why it's like, that's what we're here. Our team is here to guide you and to help you, and to figure out how we can fit these into your lifestyle, specific to you. So let's talk about support strategy 2, which is avoiding food sensitivities and intolerances. So here's another thing. We can figure out what is going on. What are you sensitive to, by doing comprehensive testing to see which foods you might have a sensitivity to, and avoiding those so that the gut can heal in the meantime. Because there could be a lot of different symptoms associated with food sensitivities, not just skin rashes. It could be, like I mentioned, bloating, lethargy, headaches, depression. It could be even fatigue, dark circles under the eyes can be signs too. So there's a lot of signs of food sensitivity. So you don't necessarily need to get skin rashes to get this done. You can just get it done as a baseline to see what is going on more internally. And of course, considering a low FODMAP diet trial. So FODMAPs are basically, think of them as high lactose, high fructose. These are foods that contain these sugars, and that can be sugars and other molecules that can be very inflammatory, and that can be that can act as food for the bad bacteria, for example. And so doing a low FODMAP diet can be very beneficial for people that are dealing with IBS, dealing with skin rashes and other concerns. Of course, this diet. It's a trial, and we want to make sure that you are supported with this, because there is a lot of different diets that, as you know, that can be helpful. So this is where we figure out what works best for you. And you can also even consider low histamine diet trials. So, like I mentioned, histamine, if you have too much of it in your food and you eat too much of it, it can, of course, make skin rashes worse. So, here are some of the things that are rich in histamine. Things, of course, like processed foods, canned foods, nuts, and certain cheeses can be very high in histamine. So, if you notice that, let's say you have a diet high in these foods and your skin rashes get worse, that could be a sign that you might have an intolerance to histamine. And of course, another one is using non-toxic personal hygiene products. And now I know there is chemicals in everything, right? But we want to make sure we minimize our exposure to these chemicals as much as possible. And because our skin is our biggest organ, it comes into contact with everything and anything. And the things that we put on our skin can be really, really good for us, or it could be really, really bad for us, because it can increase the inflammation. So I always say, as a rule of thumb, when I'm looking at a product or the ingredient list of the product, I like to make sure that it has as many natural ingredients in there as possible, and as little of the chemicals and man-made synthetic chemicals, and as little of fragrance as possible too. And it's always, whenever you're thinking about switching over moisturizers, always try to go for the natural moisturizers that we already have. Things like shea butter, things like coconut oil or olive oil, or even more of an animal product would be like organic beef tallow. Like, these are all great substitute to help with your skin, to maintain that skin barrier and prevent moisture loss. And of course, we want to make sure that we got the vitamin D levels optimal and doing well. So this is where we want to test first, and instead of guessing, to see exactly how much of the vitamin D that you do need. And another one is boosting vitamin C levels. So why is vitamin C important? Vitamin C, of course, helps with your immune system, supports your immune health. It can improve your energy. It's great for your adrenals, which is, the energy centers. They release adrenaline, they release cortisol, they help you manage stress, healthy joints and skin, because vitamin C is very important for the production of collagen in the body. So it is one of those things. So think about C for collagen. Okay, vitamin C, the C for collagen. And, it can improve heart health, healthy aging, and histamine response can be benefited from vitamin C as well. You can also use other natural products like quercetin, bioflavonoids. They are very anti-inflammatory and can really help with calming down the histamine reaction. And there are amazing, amazing natural health products with the right dosage that is effective. So how to figure out what's the right dosage and what works for you, this is where someone like me come in to give you exact dosages and things like that, because everyone is different, and we want to make sure that you're getting whatever is going to be effective for you and for your skin rashes or any other concerns. And you can even use something like aloe vera or lavender on the rash. But let me share a story with you. So I used a pure aloe vera as a face mask, and for me personally, I noticed that I have a bit of a sensitivity to aloe vera. So my skin actually ended up becoming a little bit red, a little bit itchy. So this is where, even if it is something healthy, you want to test patch first to make sure that it is working for your skin. So even things like aloe vera or lavender may sound very nice and soothing, but just please test patch it on yourself first to make sure that it works for you and it's not going to give you a reaction like it did for me. So just want to share that with you, because everyone's different and we all have a different skin and individual backdrop of things. So basically, that is a little bit of a caveat. But aloe vera in other forms can be very, very, very amazing. Lots of antioxidants. It's great for oral health. It really can be helpful for digestion. It can get things moving, and it can regulate blood sugar levels, support immune health, and it can help with detoxification as well. Another one is using bentonite clay. So I'm sure you might have used a clay mask. You might even use it right now just as a relaxation thing for self-care. But clay can actually be very good for helping absorb toxins and particles from the skin, and it can support minerals. It has lots of good minerals that can be soothing for the skin and can be nourishing for the skin. So it is another great addition to consider. And this is a DIY rash cream that Dr. Jocker is promotes. So of course, you can give it a try if you are kind of in need of looking at something that is all natural. There is a lot of ingredients here that are very good for the body, very soothing and anti-inflammatory, and go from there. And of course, this one does have some essential oils and aloe vera, so you want to make sure that sometimes essential oils can be a little bit sensitizing on the skin. So to you can arrange it, change up the recipe to your liking. And this is of course a product that is promoted by Dr. Jockers, and because this is a lot of the information is from his article, we want to just honor that and let you know about this. And so there's a lot of different like I mentioned, body care, hygiene care products. And there is actually a database called Skin Deep database by the Environmental Protection Agency, where you can actually type in a product name and it'll show you some of the concerns or the safety profile of the product to see if it is good for you. Okay, so that brings us to the end of this talk. It was a very fascinating talk and I really enjoyed doing it. So I hope that you got lots of information. And if, of course, if you have any questions, any concerns, I am available for meet and greets, as well as you can, of course, contact me through texting as well. So I just want to quickly do a summary of our upcoming webinars. So things like what is whiplash and ways to overcome this neck injury. We're going to talk about it next. We're also going to be talking about daily decisions that could be draining our energy, dining with the doc that's coming up, ready to live your life with less stress. Of course, who doesn't, right? So that talk is coming up too. And we're also going to be doing a detox workshop. So please stay tuned for those. And of course, we'd love for you to connect with us. We have our Instagram, Facebook, YouTube, websites. Let us know if you have any other topics that you want us to talk about, because we'd love to share this knowledge with you. And as always, please feel free to write a review if you do feel so inclined. So I hope you have an amazing rest of your evening.
Thank you so much, Dr. Udani, for being with us and talking from your heart and something you're really passionate about.
Thank you.
Right. Have a great evening, everyone.
Have a great evening, everybody.